Hey folks, we're back. I'm your host, BKP, and we are live here at Sycamore Crossing in downtown Blue Ridge. It is now time for Ask the Doc with Dr. William Whaley. We want to thank Georgia Cancer Research, affiliated with Northside Hospital. Dr. Whaley, we love these Friday mornings, do we not? Is it beautiful?
It's great. I want to make the viewers out there, if you are disoriented into time, place, person, and situation, which is the earliest sign of Alzheimer's disease, by the setup here today, don't be disoriented. It says the right time, it's the right person, it's the right situation, it's even the right plate, but this is a 180-degree change on the view, so now you get to see the stores over here instead of the town and the people out there because of the new furniture. I just wanted to explain why you had a new setup today.
Well, I tell you what, we have in the second segment, the sun, if depending on the weather, the sun will start coming in, and we got to make shifts, and this works out. So I just thought this morning I came up here, this is absolutely beautiful, and I thought we'd just turn it around. We try.
Well, now you're giving it a practical explanation, and I was trying to give it an artistic explanation. You didn't ask me about this.
Well, I'm getting there, but you went off and said, if you think BKP's delusional, I can tell. If you think he's delusional this morning, there's an answer to that. Dr. Whaley, tell me a little bit about your tie. You have several flags on that tie, so tell us about that.
Well, I usually wear just my American flag.
Right.
Why would I be wearing a multinational flag?
Because the president is at the G20?
Absolutely. He's standing up to the rest of the people on this flag today.
Okay.
And he's meeting with 8 people today. 8, I think. Or 8 in the next 2 days, one-on-one, to do what you said this morning. He wakes up in the morning and he tries to think, if it's not playing golf down in Florida, what can I do today to make a better America? So I'm wearing that for you, Mr. President, and I hope you have a real good talk with the Chinese, and I hope you have a good talk with Mr. Putin, and I've already seen you had your talk with the Japanese, so good luck.
Well, he is on the world stage. I think he does well. I think he represents us well. I don't think the world leaders dislike him as much as our media wants us to believe they do.
I don't believe they do at all.
Right, I don't believe that.
Macron and people like that, I think they have a deep respect for him on the one hand and wish he wouldn't tweet so much on the other.
But we have now. You can continue to go on with this subject. But
we have questions.
We have the all-star political panel. Now, don't get me riled up.
I can't do that. No,
and I have a whole group that's getting ready to get riled up.
I know. I'm glad to tell you about the shirt and
yes,
disoriented the time, place, person situation.
Well, I want to thank you for respecting that our president of the United States is traveling at this time and speaking with world leaders, and we should respect that and wait to hear exactly the outcome.
And you did ask me about the Jersey Shore. I was right smack in the middle of more pinko, commie.
I gave you a chance to go on.
Left-wing people watching those debates. I watched about 10 minutes, and I had to get my book and go out and sit on the porch. And they were sucking that stuff up like honey. But, y'all talk to the all-star panel about that. All right, so I know the first question.
All right, I know somebody was probably stomping around the kitchen, but we'll hold that for later.
My sister drinks an excessive amount. Doesn't just tell you what an excessive amount is, does it? Eyes of the beholder. Of diet sodas every day and almost no water. Could this be a contributor to her recent cancer diagnosis? Now, not what type of cancer.
Let me just say this. I want to double down on what you just said. Excessive. I wish, this is my turn. I'm not the doctor here, but I wish you would have told us what you felt was excessive.
That's what I mean.
I know, right?
Okay,
I'm doing pretty good. I'm learning after all these years.
I'm pulling it out of you.
Right.
And what kind of cancer she had.
Exactly.
Okay. Is this something that could have potentially been prevented had she not drank? That's not the right word, but we will let that go up here in the mountains. Drank so many of them a day for years? And the answer to that question is essentially no. But we're going to spend the next 15 minutes putting to rest for the people that'll listen to advice and to take science and make opinions on it, and you know, if they saw a moon rock, would believe we probably landed on the moon. All right, put that first one up there. This one question goes back to a prior study done in 1976, never replicated, where artificial sweetener, which at that time was only saccharin, was given to a specific species of laboratory rat and was associated with an increase in bladder cancer in those laboratory rats. Now, I'm going to come back to that again in a minute. One small study, never replicated. Show that first one. I was really kind of shocked at this one. This talks about artificial sweeteners in the United States in millions of dollars, but it takes these and lays them by brand name. Now, I didn't even know what Splenda was, but apparently Splenda is a big old box of stuff that's sold in the grocery store that you can use in the place of sugar in a recipe. When you talk about artificial sweeteners, my whole world is wrapped up in that can right there of artificial sweeteners, because I don't put any artificial sweetener in my tea or my coffee or anything like that. But apparently, this doesn't even make the list. The next one's Truvia. I didn't even know anything about Truvia. Now, when you get to Sweet and Low and Equal, that's the two I've heard of. At least, when you go to the barbecue joint, you get some tea and they bring you the little thing of artificial sweetener, which I don't use. It's got the Equal and the Sweet and Low in there. So when the question is written about these drinks, but in terms of the consumption of artificial sweeteners in this country, it's not these drinks at all. It's these products, and the majority of the artificial sweetener that you get every day is in food that you eat, that you bought in the grocery store, not that you made yourself. So even though you blame and see this in people's hands, that is only a tiny portion of the artificial sweetener they're getting. Go to this next one here, because it's got it focuses on part of the unwritten part of the question. Just look at this center in the middle, the relationship between diabetes and sweeteners. Now, the conspiracy theorists that you have on your expert panel would tell you that the sweet in the sweetener artificially tells your pancreas that you got sugar on board, and your pancreas is going to make insulin, and that's going to give you pre-diabetes, and on and on and on and on and on. Totally unsupported and fallacious science. Okay,
you stay in trouble, don't you, Matt?
I do, yes, I do. But he's probably showering now and not watching. Okay.
Right.
Now let's get to the next one, which is basically, this is carcinogens that are known, not debated, worldwide. Everybody's going to agree. You got that risky business one up now? All right, so if you take this, we've had this before, or generations of it, the relative contribution to cancer incidence, 35% of cancers that are caused by something that you can hang your hat on are caused by
tobacco use.
I'll be darned. And then the 20% are caused by
overweight, obesity.
Woo! Man, that's two things that are under your control, right?
Yes.
Obesity and tobacco. Now, you get into pathogens, inactive physical activity. I suppose you could put that one on top of diabetes. Diet, you notice it's the hamburger and the fried stuff.
Right.
We talked about the steaks on the grill before. Industrial exposure. We're going to come back to that again in a minute, but that would be asbestos that the construction worker got. Alcohol's way down the list, so it doesn't make me feel too bad about the single malt scotch. And then the other factors out there of lesser amount, but you're not going to find artificial sweeteners in there at all. You don't see it, do you?
No.
All right, so now we're going to get to the cancer. This next one is bladder cancer. We're going to spend a little time on this one. Here are the things that are known to contribute to the development of bladder cancer. You got that one up there. It's got the genetics thing in the middle and the little man at the bottom. Let's go to chemical exposure at work. When I first went into practice, there was over in Villa Rica, Georgia, a Goodyear tire plant. And they made tires. There was in the very next town over there a belt plant that made these big old rubber belts like in factories that haul the coal up or whatever,
yes.
or you see in a post office that you throw
yes.
things up. Well, those two
belts on a conveyor.
Belts on a conveyor, yeah. Well, both of those are made out of rubber, and there was a chemical process for the preparation of rubber to be made into things that had clear-cut carcinogistic activity against the bladder, and you would have tons of bladder cancer in those environments. And it was in the 60s and 70s that they began to recognize what that process was, and they changed the way they made rubber and brought that out of the process. But it took another 40 years. I mean, I've seen my last case of bladder cancer related to working in a factory making tires only about 5 years ago, because they stopped doing that in the 70s, and you stop and think about it, those guys are about dead now. Now, the next one that we ought to spend a little time to, lifestyle. Tobacco is a very big one, and now is probably the biggest single known carcinogistic causation of bladder cancer. But arsenic in water. You remember last week when we were talking about, the week before, no, it was last week when I was with, no, it was the week before that when you were here. We were talking about bottled water,
yes.
And they pulled all the bottled water that Walmart had off the shelves, and that Canada Dry had on the shelves because of how much arsenic was in bottled water that you're buying because you think it's safe. The amount of arsenic in the bottled water that was pulled off the shelves is sufficient to cause an increase in bladder cancer. Okay.
Why would there be arsenic in bottled water?
Because
I know that's a separate question, but
well, number one, most of that bottled water comes out of city water supplies and not out of artesian wells, but arsenic is in the ground.
Right,
And
okay,
if it
all
did
right.
come out of an artesian well or out of a stream somewhere that was contaminated with arsenic, that's where it came from, or from fertilizer. All right, the next one, and we'll get off of this cancer in a minute, is liver cancers. Got the next one up there? Oh, wait, let's stick with we'll just leave it up there, but we're going to stick with the bladder just a minute. So I said that saccharin caused cancer in a specific strain of mice, not all mice, in 1972, 3, 4, sometime like that. Saccharin was pulled off the market. The study was attempted to be replicated, and they learned that specific species of mice had a biochemical process going on in their body that handles saccharin different than other species of mice, and totally different from any other species of people, white people or animals. And so they have repeatedly tried by every other method to link artificial sweeteners with bladder cancer and with liver cancer, which I'll come up to, and the answer is no, it doesn't. But it took a while to learn that those bladder cancer species of mice had a particular susceptibility to saccharin because of the biochemical thing that they had. And then back to the liver cancer, which is this last one, we'll get off of it. Once again, smoking, right there, big, big, big. And everybody knows alcohol use is not good, but what I wanted to get to was this preventable thing at the left-hand top here. The biggest one that really exists today is hepatitis B and hepatitis C infection. Hepatitis B, children are supposed to be immunized against now before they go to school. I think that, I forget what, but it is an immunization that you're supposed to get. And hepatitis C infection, you get, where do you get the hepatitis C infection?
I'm not for sure. I'm not paying.
Gosh,
where do you
get the hepatitis C infection? You get it from a needle that you either had a drug on or you get it from a tattoo parlor.
Well, that would probably be the reason I don't know where you would get it.
Yeah, because you haven't got one. So prison tattoos that are done in sort of in the home, but many
prison tats.
Prison tats.
Yeah, just but not tattoo. We don't put tattoo on.
But many of the tats that are done here in the mountains are done by my cousin at the house. And not done at the studio. Well, even at the studio, the dye can be contaminated even if they do a good job of sterilizing the needle. So it's an encouragement, and I would like to encourage the parents to say, look, it's my house, my bat, my ball, my rules. When you are fully emancipated, you're out of high school or out of college, and I'm through paying your way, if you want to go get a tat, fine. But I see 14 and 12-year-old kids around here with tats, and I think it's better if somebody's gonna get a tat, let them be, as we used to say, free and 21, than be able to make that judgment. So that's the risk factor.
You know, when you brought that up and you said that, Dr. Whaley, I mean, I just drew a blank. I mean, I don't know how you would go get it. I wouldn't think it, but once you get into the conversation, tattoos, I've seen several. I have seen, several reports where, like you said, ink, the needles, whatever, all the above that are contributing to hepatitis C.
Just the seat that they sit in at the tattoo parlor.
Right.
I mean, it is not inspected like the office, like our office.
Right.
When you leave the room, they go through everything in that room where the visitor was sitting, and they wipe them down between every patient.
Right.
Anyway, so
I get it though, but I mean that's great information, because right now, I mean, I'm not going to go down that road. I personally don't have any tattoos. Not gonna. No. Not my time to place the judgment.
No.
But we are in a society, and we are at a time where young people, that's what they want to do.
Right.
Okay.
But I said once again, Mama, let them get their tattoo after you're through supporting them. Either been emancipated at 18, or if they're in college, get emancipated at 21. But don't let them get it while they're still living in your house and you're still in charge, even if you've got tattoos yourself.
Okay.
Make an adult judgment after they become adults. So back to the question. This question was not very well written because we don't know what the definition of excessive diet soda was. We don't know what type of cancer she had, and we don't know how old the sister was. But at the end of the day, diet sodas and the artificial sweeteners, which are by far, as I showed, the most. If you drink 3 of these a day, that's probably 3% or 5% of the diet of the artificial sweetener you're getting, because everything you buy in the store that says sugar-free or low-cal or everything else is sweetened with those other sweeteners that I showed.
Right, exactly.
So this is the most tiny part of artificial sweetener you're going to get in a day.
All right.
All right. Now we got a great one coming up now.
First of all, I want to thank the North Georgia Cancer Research Center, affiliated with Northside Hospital, for these segments. We appreciate them very much. And every week, Dr. Whaley takes on 2 questions. Then at the end of those questions, he shares the most updated medical information going on in the week. So what's our second question?
All right.
He has large print. I love it.
Well, you weren't wearing your glasses when we started.
He printed it out. He's got large print.
All right. I have recently started having to go to the bathroom after almost every meal. Not to the point that my stomach is torn up, but it's nearly immediately after eating. Could this mean that I have IBS or irritable bowel syndrome? And I will say, first of all, that when somebody asks, can something be, the answer is always yes. I mean, there's no guarantees that anything is or isn't. But we went through this once before in some detail, and clearly this question, as Josh says, follows a comment I made a couple of weeks ago about what is the normal frequency of bowel movements. And I asked Josh that morning, and I don't think the expert panel was here, but I will ask the single member of the expert panel over there, what is the normal frequency of bowel movements? Just a quick, okay, he says 2.
Could you ask your friend to turn their car off? There it is. I didn't know what was roaring in my head, the car or the normal roaring I have. I got to differentiate. Sorry to interrupt you.
The normal frequency of bowel movements is the gastrocolic reflex. Every time your stomach fills, your colon empties. So if you look at a baby, a bird, or a puppy dog, they eat and they poot. So this patient describes normal bowel habits. I go to the bathroom after almost every meal. Now, generally when that baby is being toilet trained, and it's a female, she learns to block that reflex, because when they're outside the home and mother's got a pre-verbal little girl and she goes poo poo pee pee, and they're at a filling station or a store and mama takes her into the bathroom, she either holds her up in the air over the toilet so that she's moving to target, or she covers the toilet seat with a half a pound of toilet paper, and that pre-verbal child learns that going to the bathroom outside the home has got something wrong with it, so they clamp down when they leave the home and they relax when they get back, and it affects both stool and urine, and that's why women will hold their pee-pee too, and they get more bladder infections. Now, little boys, if he says pee-pee, daddy just pulls the car over the side of the road and the little boy pees in the ditch. So boys don't get quite as much pre-verbal understanding that that going into the bathroom outside the home is not natural. Flipping back to IBS, irritable bowel syndrome affects 25% of the people in this country that are over the age of 50. So IBS is a very common condition. It's about a third to a half of the reasons that patients are ended up being referred to a gastroenterologist. So the question really is a two-part question. IBS, what do we know about IBS, and is this a symptom of IBS? And the answer is basically not. Josh, let's go to that next question. Now, to be IBS is going to be chronic abdominal pain, a change in caliber generally of stool, and clear-cut constipation, clear-cut diarrhea, or alternating. So this first one is just a clock. And the clock, if you look at the bottom, says, what's the normal frequency of bowel movements? And there you're going to see the guy ate breakfast and then sometimes later had a bowel movement. He ate lunch and sometimes later he had a bowel movement in the afternoon, and he could have had one after he had the evening meal. So if you go to this next one, which is a calendar, if it says frequency of stool at the bottom, 3 in a day, that's healthy. 2 in a day, that's healthy. That's like you've learned now to obliterate the natural history. Every other day is the constipated woman who eats too little fiber, but there's nothing that's substantially unhealthy about it. But the people who say, I have 2 in a week, that is substantially unhealthy. So now we're going to go back to the discussion we had several months ago. If you take biologically pure African population living in South Carolina, Daufuskie Island, and places of that sort, and compare high blood pressure, hemorrhoid, diverticulosis, frequency with their parentage in Africa and with the progeny in the 60s and 70s in South Carolina, the incidence of colon cancer, high blood pressure, diverticulosis was all dramatically higher in the genetically pure group that was living in the United States. Because in Africa, they ate tubers and roots and a whole bunch of sweet potatoes, I guess you'd say. And they would have 200, 300, 500 grams of stool a day, which means a pound, whereas the average American would have 100 grams a day, which would be about the size of a little bitty hot dog. So the more fiber you eat, then you're going to have more of this 2 or 3 bowel movements a day frequency. And lastly, we're going to show this poo chart here, and I'll let you take this home with you because Josh went over it and he learned a whole bunch from it. But this is this, and Jane sometimes says that our dogs have separate little lumps like nuts or looks like a sausage or a hot dog, and this applies to the dogs. But basically there is a chart like this that your family doctor can give you when you're talking about your bowel habit, and you'll be able to get some sense of how your fiber intake, the frequency of stool, and how it looks when it's passed, and how safe that is or is not. So that'll be that's about all you need to know about pooping and about.
Well, the takeaway for me is I have a poo chart for the afternoon to look over. So thank you for that. I never but I do have a question.
Yeah,
I want to double down on this.
Right.
I don't want to walk away from this without one thing. So in that question is the body of irritable bowel syndrome.
Right.
So the way it's described, you don't see this individual as having irritable bowel
Absolutely
syndrome.
not, no.
But briefly, what is irritable bowel system?
Okay, well,
I think that's important. Let's go with that.
25% of the American population over age 50
Right.
has irritable bowel syndrome. 25%. So we got over.
What's the how do you identify that?
Chronic and recurrent abdominal pains.
Okay.
A change in bowel habit.
Okay.
So from normal 1, 2, or 3 a day, 5, 6, or 7 a day. If it's on the diarrhea end, there's a diarrhea end of irritable bowel, or down to 1 or 2 stools a week on the constipation end of irritable bowel, or a alternation. So you have 1 or 2 a week, and then you have 6 a day for a while, 1 or 2 a week, and you have 6 a day for a while. It has to go on longer than 90 days. But as I say, that is up to half of the referrals from the family practice doctor to the gastroenterologist. Because once you get to that situation, if you haven't had your routine colonoscopy at age 50, and again I said 25% of people over the age of 50, it's time for Dr. Tidman or Dr. Trigg or one of them to send you off for your colonoscopy and a consultation. So
well, you know,
that's chronic abdominal pain, a significant change in bowel habit, and then taking that chart, which is the most important part. You're either down here at the bottom end, which is unhealthy, watery, no solid pieces, entirely liquid. It looks like get checked. It looks like pee. Or way up there at that end, you need to get it looked at.
Well, you know, I never say, and all due respect, this is great information briefly, but I do have, I think I have one lady that's probably been stomping around the kitchen all week, and then I got another one over here that I know is all worked up, and Rick and I are just going to be in the shot, so that's about how it's going to go. That's why I got to get that. I mean, I see them over there. What is new happening out there, or what is information you want to make sure our viewers have?
We're gonna just rattle them right off because they all tie right up. Suicide rates are rising among teens. The very next one, energy drinks. Are they a quick pick-me-up or health hazard? The 1/3 of teens between 12 and 17 use them on a regular basis. All right? So now we got teens getting suicide. We got teens drinking energy drinks. San Francisco's the first city to ban e-cigarettes. We've already got to the e-cigarette nicotine in teens. And then the bottom one, young men putting health risk to bulk up. That's that testosterone.
Right.
So those 4 things are in the top 6 this week, and they all reflect back to what we've been talking about for months. The energy drink use in a teenager interferes with their sleep. The e-cigarette nicotine bang interferes with their sleep. I've got to take something to make me good looking and strong interferes with their hormones. And lastly, what happens to that group of people at the very top, suicide rates among teens rises. One more time. Discipline, guys, discipline.
When we started this several years ago, I was aware that sleep is important, obviously, but since we started our segments together over the years, the things that interrupt our sleep, the things that don't allow us to get the good night's sleep that we need to function, like the kids need to turn the phones off, right? Yeah. Things like that.
No. Kids don't need to turn them off.
At night.
Mama needs to take them away.
Okay, got it.
8 o'clock at night and give them back after breakfast so that they're not even in the teen's room at night.
But, what I get at is like, all right, I got to get on to something else, but I get confused on, and I don't like to get generational, but when I was a kid, or young, okay, so I'm 20 years old, and I work construction. And we stopped by the 7-Eleven in the morning, and I got a cup of coffee, buttered roll, got back in the truck. We were on the construction site at 7:30. We worked. I don't want to get into it. I don't know how this sounds, all right? Don't take us wrong. We worked. Yeah. I mean, we ran.
You were too tired to stay up all night.
But what I'm saying is, I can go to the store in the morning and get a cup of coffee, and I'm in line with a bunch of young people that have 2 and 3 of these monster things, and I want to call it these drinks. I'm like, what do you need that for?
They don't need it.
They don't need it.
There's no reason for a adolescent or young adult to be fatigued.
Right.
So they don't need an energy drink ever.
Because Josh knows, right, Josh? I'm the oldest in the group, right? Not one of you can keep up with me. I'm not putting you on the spot, but you know that, right? They know that. They can't keep up with me. Anyhow, that's a good segue out. I'm getting in trouble now, too. Right. There's your tie. Dr. William Whaley, Ask the Doc. And listen, we want your questions. You send those to info, I-N-F-O, at fetchyournews.com. Put in the subject line, Ask the Doc. And we'll get them over to Dr. Whaley. Also, look for us on all the social media. Fetch Your News on social media, Instagram, Twitter, Facebook, and we always have Ask the Doc promos on there. If you want to put something on that, we search those throughout the week. Get your questions there. So send your questions to Ask the Doc at info@fetchyournews.com. Also, if you like this information, great information Dr. Whaley brings every week. We have a playlist on our...
Put the poo chart on the website?
No poo chart. No poo chart.
All right. I'm leaving it for you, though.
We're going to discuss the poo chart in the next segment. I hope that was wrong. Let me wrap this up, okay? So anyhow, if... you would like to share these segments with your friend, go to our YouTube channel, Fetch Your News, FYN TV. Look for the playlist, Ask the Doc. Share them with your friends. They're all there. And again, we thank North Georgia Cancer Research Specialist affiliated with Northside Hospital always for this segment. We're out. We're going to discuss a different kind of poo chart right after these messages. What a segue.
Yeah.